I've got so many patients coming and asking me which weight loss medication is best for me. We've heard of so many different names, Wegovy or Ozempic, Mounjaro or Zepbound. Which one works best and what's the difference? Hey everyone, I'm Dr. Nicole Edwards. I'm a board certified obesity medicine physician practicing in Columbia, South Carolina. I help my patients to manage their weight and to get that slimmer body appearance that they're looking for and to feel better overall. So let's talk about these weight loss medications. What's the difference in them and which one would work best for you? All right, when it comes to semaglutide, okay, semaglutide is a GLP-1 receptor agonist. It works in the body by making you feel fuller faster, making you, your bowels don't digest the food as fast, so it stays in you, so you feel fuller longer, and then it turns down food noise, so you're not even thinking about food, you're not even hungry. All right, that's one of the ways that it works. It has been branded as a weight loss medication as Wegovy, okay? It has been branded as a diabetes treatment medication as Ozempic, all right? And it first came out as Ozempic, and then later on it was FDA approved for weight loss under the name Wegovy. They're all the same thing though. Wegovy, Ozempic, semaglutide, all right? Those are GLP-1 receptor agonists. Everybody's heard about all the problems that could possibly cause, the side effects that could possibly cause. It can make you nauseated, you could have vomiting, you could be constipated, or you can have diarrhea, you can have headaches. And those things are true, and those symptoms can be related to how fast you're taking the medication, the dose of the medications, and what are how it works. So let me break that down. We start everyone on a very low dose, okay? A very low dose. And then it's titrated or raised up slowly. If you raise up the dosing too fast, then you will have more side effects, okay? Or if the dosing gets too high, then you'll have more side effects, the nausea, the vomiting. If you eat too much, okay, you'll have nausea and vomiting. If you are not drinking enough water, because not only does it turn down the food noise to where you're not hungry, it also makes you not thirsty, and so you forget to drink your water. If you're not drinking enough water, you can become constipated. All right, one of the ways that GLP-1s work is it helps to trap fat and excrete it from the body. So if you eat a very fatty meal, like fried food, then you're going to be running to the bathroom with more diarrhea. Okay, so the side effects really have to do with how you're eating, how you're drinking, and the dose that you're taking, and how fast that you're taking. These are injections that you give yourself once a week, and they can come in a pen if you're using the branded ones from the makers. Then it also comes as a compounded. When it became in short supply, then they started, we were allowed to compound it. And so a compounding pharmacy can give you a vial where you're drawing up the dose. Where I see problems is patients are drawing up too much, okay? So my office, we actually draw it up for you. But there's some people that just will ship it to you and you draw it up yourself. If you give yourself too much because you're getting a little too overzealous, because you're just trying to say, hey, if I lose weight faster, if I take a higher dose. It's not the way it works though. It's gonna have more side effects if you do it that way, all right? So what's the second medication that's out? Tirzepatide, also known as Mounjaro and also known as Zepbound. Tirzepatide has the GLP-1 receptor agonist in it as well. It also has something called a GIP receptor agonist. That stands for glucose-dependent insulinotropic polypeptide. Very long word. So basically the Tirzepatide has two medications in it, GLP-1 and the GIP. What it does, not only do you get the decreased food noise, the feeling fuller faster, and the food is sitting in your stomach longer so you are not hungry, but it also has receptors for the GIP where it's working on fat oxidation, which means it helps to break down and block fat. So with the Tirzepatide or the Mounjaro or the Zepbound, people are seeing more weight loss with it because it has two medications in it. All right, and the two medications work different ways in the body. What we've also seen is that people that have lots of stress in their life, so lots of cortisol, lots of stress hormone, the GIP can work a little bit better on the stress levels in the body, fighting that cortisol. And again, it helps to grab the fat and it's excreting it from the body. And so you're going to get more of a slimming effect. Okay. And I always tell my patients, we're not looking for pounds lost. We're looking for fat loss. Okay. That's how we're going to really take a hold and take better control of our weight. So which one is best? Well, they both work and they both work great. I have had success with numerous patients on both medications. What I have found though, because the tirzepatide has 2 medications in it, you can see more fat loss, and so you can have more weight loss with the tirzepatide. When it comes to the numbers, we are seeing anywhere between 9 and 14% weight loss with the Ozempic or the Wegovy or the semaglutide, and we're seeing anywhere between 14 to 19% fat loss or weight loss with the tirzepatide, Mounjaro, and Zepbound. So you're going to see more weight loss with one. However, it does not necessarily mean that the other won't work. So when it comes to which one is best for me, whichever you can afford, first of all, and whichever your doctor has determined is best for you. All right, there's a lot of places out there now that are putting people on this. You can order it now from online, which is kind of scary to me. So first things first, make sure a doctor is prescribing it for you. Make sure that you're getting somebody who has knowledge of it. One of my biggest pet peeves is I see people prescribing this and then giving you things like Zofran or anti-nausea medications so that you won't feel nauseous. But what that does is it actually allows you to overeat, which kind of doesn't make any sense because that's what it's supposed to be doing, is keeping you from overeating. All right. So I always say to my patients, a hard head makes a soft behind. So I kind of want you to feel some of that when you have restriction, when you are full, so that you can stop eating and you know to stop eating. So which one is best for you? Whichever works best for you. I've had some people who we tried them on semaglutide. It was okay, but they had more weight loss with the tirzepatide. I've had some people that were on the tirzepatide, maxed out on the dose, and we switched them to semaglutide, and it worked for them as well. All right. So when it comes to which one works better for you, it's all different for each person, and you really need to be going to a board certified obesity medicine physician to figure out which is best for you. Now, like I said, cost is another issue. Insurance is not paying for these medications in most states because they consider weight loss to be cosmetic and not for your health. And so here in South Carolina, most insurances are not covering it. You'll get the first month for free or for $28, right? That first month, they give you a little coupon. But that second month, they're going to hit you with anywhere between $800 to $1,400 for the medication. So it's expensive. Now, the compounded versions of it, which are the semaglutide or the tirzepatide, are a lot more cost effective. So when it comes to which is best for you, whichever one you can afford and whichever one your doctor feels is best for you. All right, guys, when it comes to which one's better, they both work. So there's not one that's better for everyone. It's which is best for you. That's best to be determined with you and your doctor. If you need a doctor who can prescribe it and who understands it, come see me if you're in Columbia, South Carolina, or if you're in South Carolina. I can work with you and we can figure out which weight loss medications and weight loss program is best for you. Again, I'm Dr. Nicole Edwards. I'm a board certified obesity medicine physician, and I'm here to help my patients slim down and get the weight and the wellness and the happiness with their hormones that they desire. Thanks so much.